How you doing today, Justice?
I'm doing okay. How are you?
I'm doing all right. Okay, you were referred to us by your primary care physician to conduct this addiction survey index. Okay, this index consists of 7 potential problem areas. Um, the areas are medical, employment, supports, alcohol and drug, legal, family, social, and psychiatric. Okay, so this, yeah, it's pretty in depth, but 2 areas of focus is the last 30 days and lifetime use history. Um, I'm going to ask you some different questions, and at any point in time, if these questions become uncomfortable for you, you do have the right to refuse to answer the questions. Some of them are a bit personal. Also, any answers that you give us is kept confidential. We do not share with anybody without your written consent to do so.
Okay.
Okay, and even that consent's only kept on file for a limited amount of time. Um, Typically, it can be anywhere from 30 to 180 days, depending on the inquiring place that wants to know.
Okay.
Okay. The only thing I ask you is just try to be as honest and accurate with the answers as possible. That really helps us to be able to establish a baseline of where to start. Uh, to determine the adequate level of treatment for you,
Okay.
if that's so warranted. Okay. So this isn't it's not really bad. We're not trying to do anything other than get you some help
Okay.
if you need it. Okay. So first thing we're gonna start with just a little general information. How long have you lived at your current address?
This is I live with my parents, so this is the house I grew up in.
Okay. So you 25,
25, yeah.
so 25 years. Okay, cool. Okay, and you said that's the house you grew up in, so I'm assuming that it is owned by
Yes.
your parents. So that would be a yes. What is your date of birth?
10/3/1993.
Okay, and what race do you consider yourself?
African American.
Okay, and do you have a religious preference?
Baptist.
Okay, and have you been in a controlled environment in the past 30 days, such as jail or alcohol detox or hospital?
No.
Okay, okay. Okay, so we're going to continue with reviewing your medical status.
Okay.
Okay, so how many times in your life have you been hospitalized for medical problems? And this includes um, overdoses, detoxes, childbirth, and overnight stays in the hospital.
Never been in any detox or anything like that. I was admitted after the car accident.
Okay, and um, were you overnight or in there for any number of days?
It was about 4 days.
Okay, okay, and about how long ago was your hospitalization for that problem, physical problem?
That was a year ago.
Okay. Do you have any chronic medical problems which continue to interfere with your life?
I'm still having pain from that car accident. I had to have a surgery, and I'm still suffering pain from that.
Okay. Are you are you taking any prescribed medication on a regular basis for a physical problem?
I was prescribed pain pills, Percocets.
Okay. And I'm assuming that was a result of that's the problems with from the car
Yes,
accident.
yes.
Okay. Okay. And do you receive a pension or anything from physical disability?
No.
And how many days have you experienced medical problems in the past 30 days?
Um, I'm gonna say at least 2 weeks. Periodically once you lump them together, it's about 2 weeks out the month where I'm in pain.
Okay. Okay, so it's 14 days pain related. Okay. Okay, for the next two questions, I'm going to ask you, there will be a rating um, from 0 being not at all, 1 being slightly, 2 being moderately, 3 being considerably, and 4 being extremely. I'm going to need you to rate the answer according to that scale, okay?
Okay.
Okay, how troubled have you, sorry, how troubled or bothered have you been by these medical problems in the past 30 days?
Considerably.
Okay, so that would be in 3. And how important to you now is treatment for these medical problems?
Considerably too.
Okay, and this here is an area that we're going to cover concerning education and support status. Okay, so it wants to know how many years of education have you completed? GED will be 12 years.
I graduated from high school.
Okay, so that would that be 12, just 12 years?
Hmm.
Okay. Any training from a technical, sorry, any training or technical education completed?
No.
Do you have a profession or a skilled trade?
No.
Do you have a valid driver's license?
I did.
Do you have an automobile available for use?
Yes.
How long was your longest full-time job?
I have been at my current employment since I was 19.
Okay, so that,
So about 5 years.
okay, okay. And usual or last occupation?
I work at a collections agency.
Okay. Does anyone contribute to your support in any way?
My parents helped me. I mean, since I live with them.
Okay. And does this support constitute the majority of your support?
No.
And I'm sorry, usual employment pattern in the past 3 years, full time being 35 hours a week, um, student, military service, retired, disability, unemployment, or in control environment.
Full time.
Okay. How many days were you paid for working in the past 30 days? And this includes under the table work, paid sick days, and vacation.
No under the table work, but I haven't missed any work in the past 30 days.
Okay, so you've worked a whole month. Okay, great. Okay, we're still continuing with the employment and support status. Um, so, how much money did you receive from the following sources in the past 38 days? Employment.
Employment, probably about 2,500.
Okay. And
I got a really good bonus this month, so.
okay, great. Um, were there any type of unemployment compensation,
No,
welfare, food stamps, or pensions and benefits?
no,
Um, family or friends or mate,
no,
and any drug dealing, stealing, fencing, stolen goods, gambling, prostitution.
did I earn any money from those?
Right.
No.
Okay.